In this video, we're going to conclude our look at the digestive system, and here we're going to look at the diseases of the digestive system. Oh, there's Henrik Sedin there first, of course. And what we've got is we have disorders of the digestive tract itself, and then we have disorders of the accessory organs. So we'll first look at disorders of the digestive tract. First of all, we have stomach ulcers. And what this is it's an open sore in the stomach wall, which is caused by a gradual disintegration of the tissue which lines the stomach. And it has been determined that most of these are caused by the bacteria called Helicobacter pylori. And this is a bacterium that impairs the ability of the mucus cells to produce the protective mucus for the stomach wall. So if you don't have enough mucus lining the stomach wall, as we know, the pH of the stomach is very low, around 1 or 2, because of the production of hydrochloric acid by the stomach cells, then you can get an erosion of the wall of the stomach. It can also be caused by viral infections or overuse of anti-inflammatory medications. Aspirin itself can be one that's very irritating to the lining of the stomach, but also many other anti-inflammatories, and that's why many medications are required to be taken with food, and it's for that reason, so that it doesn't irritate the stomach wall quite so much when taken with food, and can be treated with antibiotics that kill the Helicobacter pylori if that's what the cause is. And many people have experienced great relief after being treated with antibiotics. So here's kind of an image of it where you have the gastric ulcer in the middle there. And then these two researchers, Barry Marshall and Robin Warren, they won the Nobel Prize in 2005 for discovering that most stomach ulcers are caused by a bacterial infection. I thought that this was determined to be quite some time before 2005, but I could have my timeline incorrect on that. So that brings us to diarrhea then, which is loose watery feces. Acute diarrhea can be caused by infections of the small or large intestine with either bacteria, viruses, or protozoas that could have contaminated drinking water supplies. And indeed, this is one of the biggest problems in developing countries is having a clean water supply, and many people each year still are dying just simply because of not having access to clean water. So what happens is you get peristalsis increases, and less water is absorbed by the small or large intestine. Uh, Also occurs in chronic situations from time to time with persistent inflammation of the intestine due to conditions such as Crohn's disease, which is a misdirected immune response against one's own intestinal tissues and bacteria. Could also be a genetic predisposition and some environmental factors as well with this condition. Can be a very serious problem for people, and in fact sometimes people actually have part of their large intestine removed just because it's been so troublesome for them. Constipation then, this results in dry and hard feces. It can be caused by ignoring the urge simply to defecate, or by inadequate fluid or fiber in the diet. And so once again, we need to be sure that we're taking in enough fluid and fiber. And in fiber, we're referring to the insoluble fiber in this case as well. If you recall, we talked about two different types of fiber, soluble and insoluble. This would be the insoluble type of fiber. Chronic constipation, it can lead to hemorrhoids, and these are inflamed blood vessels in the anus and can be very painful. It can bleed sometimes as well. Obviously, then it's just simply prevented by increasing the amount of water and fiber in the diet. Laxatives and enemas, they can be used, but that can also irritate the colon. So it's best just to ensure that your diet is high enough in fluid and fiber intake. Then we have polyps and colon cancer. Polyps are small growths that arise from the epithelial lining in the colon. They can be benign or cancerous. Most of the time they are benign, but occasionally it is determined that polyps are indeed cancerous and they need to be treated very aggressively. They're usually detected by a colonoscopy where endoscope is inserted into the colon, and that enables the viewing of the wall of the large intestine. And if polyps are detected, then often they can be removed immediately, and then they'll be tested to see if they're actually benign or if they're actually cancerous tissue. Um, this still is, still quite a problem, and they can be found in people of all ages, from people in their 20s right up to 80s and 90s, and when they are detected, they needs to be determined whether they're cancerous tissue or not. Then we have our accessory organs. First of all, we have the pancreas, and pancreatitis is an inflammation of the pancreas, largely caused by excessive alcohol consumptions or gallstones that block the pancreatic duct or some other unknown factors. Uh, Chronic pancreatitis is where digestive enzymes secreted by the pancreas damage the pancreas and decrease insulin secretion. Pancreatic cancer is never a good thing, and it is almost always fatal. And you can see the stat right there where 20% of patients, only 20% of patients, are alive 1 year after diagnosis. So, and unfortunately, it's not really well understood how pancreatic cancer develops. So, as far as preventive measures go, there's really not a lot known as to what you can do to prevent it from occurring. Then we have diabetes, and we have type 1 and type 2 diabetes. And type 1 is where the pancreas is not producing enough insulin. Type 2 is where the body cannot properly use the insulin that's being produced. In either case, what happens is the blood glucose levels, they rise, but the use of the glucose by the cells that need the glucose is impaired. So what happens is you have excess glucose in the blood, and that can sometimes spill over into the urine if the levels get high enough. And so one way to screen for diabetes is using the glucose test strips in the urine to see if glucose is indeed present. So because blood glucose can't be used by the body then metabolizes fat, which leads to the buildup of ketones in the blood. Ketones, they metabolize into acids, which then reduces the pH levels in the blood, which can lead to serious situations and to coma and death of the individual if it's not dealt with. This situation referred to as a ketoacidosis. So the blood glucose tolerance test is used to test for diabetes, where a person needs to fast for, I think it might be 12 hours or maybe longer, and then they ingest a known amount of glucose, and the blood glucose concentrations are measured at different times. And you can see on the graph here, a normal response to a blood glucose load would be the colored in brown there, and then somebody with diabetes, they would produce or they would show blood glucose levels of the blue graph. And you can see the renal threshold is whereby if blood glucose levels get above that, then it spills over into the urine. So with type 1, About 10% of individuals with diabetes will have type 1. It used to be called juvenile onset, but we're getting away from those terms now. Type 1 is where the body is not producing enough insulin. Treatment is through injection of insulin. Thankfully for these folks now, they have these automatic pumps which inject insulin at appropriate times throughout the day, and this is much more convenient for people with this condition, and quite often you won't even know that somebody is using an insulin pump. Type 2 then, this can occur in adults and children, and basically the main situation here is just simply obesity. And what happens is fat tissues produce a substance that impairs the insulin receptor function, or it's also thought perhaps that the number of insulin receptors on cells, the numbers actually decrease in obesity. So that just simply means then that not enough glucose is going to be able to enter the cell. So treatment then, just getting back to a normal weight range for these individuals. And sometimes these people actually need to supplement with insulin, but once they get back into a healthier weight range, then quite often they don't even need the insulin. Um, they don't need to supplement their insulin any further. So can most of the time can be reversed quite easily. Then we have the liver and the gallbladder. Hepatitis is an inflammation of the liver, commonly caused by viruses, and we have the three different types, A, B, and C. A is much more easily transmitted, but it's a less serious condition. Hepatitis B and C, these can only be spread by sexual contact, blood transfusions, or contaminated needles. Type C used to be called non-A, non-B, so now they just simply call it type C. There is no known cures for type B and type C, so obviously very serious conditions, and quite often will shorten the life of the individuals that have contracted hepatitis B or C. Cirrhosis of the liver then, this would be usually for chronic alcoholism. Once again, we've talked before about the fact that alcohol is absorbed directly into the stomach, and then the first place it goes to is the liver. Alcohol is quite toxic, well, to the body in general, but of course to the liver itself. With large amounts of alcohol, it has to deal with that, and so over time, the liver can repair itself. However, if the rate at which it's being um, if the rate at which damage is occurring is not matched by recovery, then you can lead to a situation of cirrhosis, and eventually a person may require a liver transplant. Gallstones then, these are small hard masses that form in the gallbladder, and for some reason the cholesterol can precipitate out of the bile salts and then forms crystals that grow into gallstones. And sometimes the passage of the gallstones from the gallbladder may block the common bile duct and cause jaundice, which is yellowing of the skin and eyes due to the buildup of bilirubin. If the gallstones can't be removed, then the gallbladder itself must be removed. This used to be a real major surgery, but fortunately now they're able to do this quite often with scopes rather than major invasive surgery. And that should cover the conditions that we're going to look at from the digestive system.